Okay, good day. So today we're gonna talk about the urinary system. Okay, so introducing myself, my name is Jessica Abo from 12E6. Okay, so our learning outcomes for today is to describe the process of urine formation and to illustrate how the urinary system works with other systems to maintain pH and body fluids. Okay, so first off, what is the urinary system? So the urinary system, also known as the renal system or the urinary tract, consists of the kidneys, ureters, bladder, and the urethra. So its purpose is to eliminate waste from the body, regulate blood volume and blood pressure, control levels of electrolytes and metabolites, and also to regulate blood pH. So, how do plasma flow, right? Through arteries, nephron, and veins. So first, it's gonna go through the renal artery, okay? And then it's gonna be divided into smaller arteries, which are the arterioles, and then it will get contact with the nephrons. And in fact, when you have a kidney, each kidney consists of a million nephrons per kidney, right? And it's where blood filtration and urine formation take place. And then when it's already filtered, it will go pass through the large veins and exit through the kidney through the renal vein. So what passes through the renal vein is the proteins, nutrients, water, and some ions return to the blood, while the waste, controlled amounts of water and ions secreted will go to the ureter. Okay, so so let's talk about the steps or processes of urine formation. Okay, so there are three steps. So first step is filtration, wherein water and dissolved substances are filtered out of the blood at the entrance of the nephron. Blood pressure drives substances across the capillary walls into the nephron, and it pours and pores in the filter allow water, urea, glucose, ions, and amino acid to pass. But large structures such as plasma proteins, blood cells, and platelets remain in the bloodstream. Okay, so small passes but large remain. Okay, so second step is reabsorption. So useful materials such as ions, water, glucose, and amino acids return from the nephron and collecting duct to blood. Okay, it's also a process wherein nephron removes water and solutes from the tubular fluid returns to the circulating blood. Last step is secretion. Okay, so toxic substances and drug residues are secreted into the nephron to be eliminated in urine as hydrogen ions and other surplus ions. Okay, so mechanisms. There are also three mechanisms our body uses in maintaining blood pH. So first is the buffer system. So excretion of H plus ions in the urine and the reabsorption of bicarbonate in the blood plasma, wherein bicarbonate neutralizes hydrogen ions in the blood. So if your blood is too acidic, more hydrogen ions are excreted. But if the blood is too basic, then less hydrogen ions are excreted. So, second mechanism is a pulmonary regulation, wherein the concentration of H plus ions in the arteries increases, the body responds by breathing faster, which increases the rate of release of carbon dioxide out of the body. Last mechanism is the renal regulation, wherein renal regulation of acid-base balance, the renal process of bicarbonate reclamation prevents the loss of bicarbonate in the urine and thus maintains plasma levels of one substrate that is instrumental to preventing minute-to-minute pH fluctuations. So what is the implication between acidosis or alkalosis? So they are two different, okay? Because acidosis is when your body fluids contain too much acids, wherein your pH level is 7.35 or lower, and in symptoms are fatigue or drowsiness, becoming tired easily, confusion, shortness of breath, sleepiness, headache, and its causes are chronic airway conditions like asthma, injury to the chest, obesity, which also can make breathing difficult, sedative misuse, overuse of alcohol, muscle weakness in the chest. Okay, so let's move on to alkalosis, which in your body has too many bases. And it's just the opposite of acidosis, when your pH level is 7.45 or higher. So its symptoms is nausea, numbness, prolonged muscle spasms, muscle twitching, hand tremors, and its causes are hyperventilation, which commonly occurs with anxiety, high fever, lack of oxygen, salicylate poisoning, being high altitudes, and liver disease. Okay, so thank you. Hi, thank you so much again for listening to one of my discussions. I hope to see you soon and see you on the next video again. Stay safe and God bless. Okay. Okay. Thank you so much, everyone, and I hope you enjoy.